I have an appointment with Anisa today.
Perfect. See you on the books. Let's come on back.
Perfect, thank you.
You're welcome. Are going to be in here today, and Anisa will be in shortly, okay?
Thank you so much.
You're welcome. Okay, Anisa. Ashley is in room A, ready for you.
Perfect, thank you. So I just looked at Ashley's chart. It looks like she's interested in lip filler and Botox, so follow me, let's get started.
Really cute.
Hi Ashley.
Hi.
Hi, how are you?
Good.
Good. My name's Anisa, I'm a nurse practitioner.
Nice to meet you.
I'm
I've heard
excited.
such good things about you.
I know, I
From
love
Bethany.
She's like the buzz. Have a seat here, my love.
Okay.
I'm gonna get started. So typically the way that we do these consults is I'll hand you the mirror. We'll talk about your lips and what you want to improve, and
Okay.
same with your Botox, and then we'll kind of take it from there.
Okay, sounds good.
You can take your mask off since we're in the room. And then I have you hold this up and then grab my pointer. Alright. Have you had lip fillers before?
I have.
Okay.
Yes.
When was the last time you got treated?
4 months ago?
Okay.
4 months ago, in November. I've had them twice.
Okay.
Never had Botox though.
Okay. Perfect. Yeah. Would you remember what product they used in your lips about 4 months ago? Like a Juvederm sound familiar or Restylane?
Something like that.
Okay.
Yes.
Okay,
Like
perfect.
the hyaluronic.
Hyaluronic acid
Yes.
base. Perfect. Excellent. Well, let's take a look at your lips together in the mirror. Okay, so you have a really pretty cupid's bow. So there's no reshaping that really needs to be done there.
Mhm.
Notice how they kind of taper down here in the
Yes.
corners.
Yeah, that's, I hate, like I have a standing frown face.
Yeah, but luckily Botox and filler, I can literally flip the frown upside down.
That would be amazing.
But yeah, I know what you mean. When they drag in the corners, it makes you look like you're frowning, but
I
you're
know.
not.
And especially like on this side too, I feel like this side is like a little more droopy.
Yeah. Okay, let's talk about all of our options. Let's focus first on the lips. So you're gonna follow along with me. So I'm gonna invert the edges of your lips so that way we get a little more rollout and you can
Perfect.
show a little more pink.
Yeah.
That's accomplished by 2 ways, with the filler and a Botox lip flip.
Okay.
Botox helps rotate the lip out so you can see more of the filler, and it actually allows the duration of your filler to last about 1 to 2 months longer.
Awesome.
So it's kind of nice. And then when you smile, then look in the mirror and smile for me. You see how it kind of goes into a straight line at the edges? The flip will allow it to stay stable like this, so you see the filler and it doesn't swing with it.
Perfect. Perfect. That's exactly what I'm looking for.
Yes, good for you. And then go ahead and relax one more time. Let me just take a look at one more thing here. I think because we're doing some reshaping in terms of really having the edges stand up and show, I don't think volume is necessarily what we need to go after for your lips because you already have beautiful projection. I think structure is what we need more than anything.
Okay.
So for that reason, I'm going to choose Restylane Kiss. It's like one of my favorite fillers. It's literally so astonishing in terms of the shape you can create with it. And then I'll put in these tiny little needles to make sure that we're really precise so you're lump and bump free.
Awesome.
Yeah. I'm gonna go ahead and fill the corners for you as well. So that way I can literally invert the edges too this way so they don't drag down.
Yes.
And then do me a favor, give me a really sad face. Like, yeah. Okay, take a look here. You see how the puckers at the edges here? This muscle that tethers the corners down, that's called the DAO muscle. Depressor angular oris is the term for it. Long story short, if we relax that little pull you have here naturally that anchors the corners down with some Botox, it literally flips the frown upside down.
Oh,
so I
perfect.
say we do a couple units.
Yeah,
to
let's
help
do it.
the edges go up.
Perfect.
Give me a sad face one more time. I'm thinking about 3 units on each side would be beautiful for her. Personally, on myself, I love it. It makes me talk like I'm smiling.
Perfect.
So, you like it?
Perfect.
Yeah.
That's like the biggest
Right.
thing that, yeah, when I look in the mirror, I just look sad or it's
Yeah.
like drooping.
Yeah, I got you now. It's an easy fix, so we'll definitely do that. And then go ahead and relax your face all the way for me. I'm just going to talk to you about something that we didn't bring up, but I think that would really help support the mid-face. Go ahead and look in the mirror. You have beautiful mid-cheeks here. Like literally people pay for that mid-cheek. And you have it naturally, you're so lucky. But the outer part of the cheek, you see how it's a little bit flat on the sides here?
Yeah.
If I can help build up your cheekbone a little bit, look what it does downstream. It helps correct the nasolabial folds, smile lines,
Yes.
the marionette lines, and the jowl. So let's look at it one more time. Look at the mirror again. That lip will literally help open up the face nicely for you. So I would recommend at some point, either today or in the future, treating the cheeks because you're gonna get a beautiful mid facelift where everything lifts and we don't have to focus on filler so much centrally and low, which can contribute to making you look heavier.
Okay.
Yeah.
Yeah, absolutely.
Let's talk about Botox.
Okay.
So we're gonna go backwards. Botox is really good for horizontal forehead lines, frown lines, and crow's feet. So let me see where your eyebrows up as high as possible. Surprise. Good. You don't have terrible forehead lines. This is an area where I don't think you really need to treat. And given the position of your eyelids, so I'm going to relax all the way and see how the eyelid is descending just a little bit. I personally have experienced patients with this eyelid. If we do relax the forehead, you feel really heavy and you feel like you're almost a little bit droopy. I don't want to give you that sensation, so therefore I'm going to skip that area. So onto frown lines, get really mad for me. This is an area pretty strong. Recommend full correction here. Don't worry, we all have it.
Yeah.
So let's get after that. And what's nice about treating that is you see this little crease on the nose?
Yep.
It treats that as well.
Okay.
And you get a little mid-brow lift, which is like an eye-opener. I love it.
Awesome.
So I want to lift you this way with the frown line correction. Sorry about that. I also want to lift you this way with the crow's feet correction. So smile for me really tight. Squeeze hard, 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 hard. Yeah. 2, 4, 6, 8. I recommend 8 units around the eyes, not only to treat this crease here for the crow's feet, but go and relax. It will also bounce the tail ends up, which is a good eye opener for allowing makeup so you don't have that transfer on the lash line.
Okay.
Later, we'll talk about smile line. This is an area I'd rather you wait on because I want to always treat mid-face first before filling centrally like I mentioned before. But I am going to tell you that I do notice that and I appreciate it with you, but this should be the last thing on your list to treat.
Okay, perfect.
Is there anything I didn't cover that you wanted to talk about?
No, actually you covered more than and yes.
Yeah, I did. Like,
Do whatever you need to.
I love it all. You're so good. I love it.
But definitely I like what you were saying with
The mid-face.
with this. I'd like to do that for sure. And then wherever you see fit with the lip flip and all that.
I have a question for you. Now that I see you smile again, really big in the eye. Look. See the muscle right here that curls into the nostril? And it kind of makes this area look a little full.
Yeah.
I have this too on my nose.
Okay.
And I hate that the smiling makes me look like I'm snarling. I like to Botox around my nose to prevent that snarl. And what's nice about it is, go ahead and smile really big again. You see how you show a little, hard. Yeah, you see how you show a little gum? Botoxing around the nose helps lower the lip from showing the gum. Okay. Limits the nose and helps that smile line not look like it's snarling.
Perfect.
So I like doing around the nose, so I'd like to do that for you today.
Sure.
Wrinkle one more time, let's see how many units. Yeah, let's do 4 and 4. So we work on a little treatment plan for you. Okay. Dakota will come in, go ahead and kind of break down all the costs, and you do whatever you feel comfortable.
Yeah, absolutely. I'm here. I drove all the way here from Ventura.
Oh.
So I am here for anything that you see fit.
I love it.
And you're amazing. Bethany has like the most amazing things to say about you.
You're so sweet. Thank you so much. I love her too. All right, girlie, hang tight, and I will be right back. I'm super excited to treat Miss Ashley. She's adorable. I just personally feel that when patients are super excited and happy, they get literally the best treatment and results. As I mentioned, I'm going to focus on her Botox and her lips today because that was her 2 primary reasons of coming in. We're going to treat her frown line to 30 units of Botox, so she was really strong centrally. She had those deep 11s, and what's nice is that she's going to get that beautiful elevation of the mid-brow. Next, I'm going to treat her crow's feet area. I'm going to do a really good dose here because she had a little crease here. I'm not focused on that crease on the side of the eye. I'm more focused on the lateral lift. So I'm going to again lift her centrally and laterally for the best brow lift while also correcting crow's feet and frown lines. Notice how the position of her eyelids were a little bit lower, so I'm going to skip the forehead. When you have a position of the eyelids a little bit lower set, you do feel heavy and you feel like your eyebrows drop, so I do not want to do that to her at all. Other Botox areas I mentioned is around the nose. That's going to help not only with the bunny lines, again I'm not treating it for the bunny lines, but it's going to help slim the nose, and it's also going to help the shadow from her smile line looking a little more relaxed, as well as lower the upper lip from showing a little gum. We're going to do a Botox lip flip to help evert the edges of the upper lip, and we're going to do a little Botox on the DAOs to help her frown turn upside down. I'm going to do a little bit of filler from her lip in the little marionettes or the oral commissures to help again rotate the edges of her lip up so it looks like she's smiling. On her treatment plan, I'm also going to prioritize her doing her cheek and smile line filler at some point. I'm not sure she's going to go for it today, but let's see what she says.
So after consultation, Anisa will come and tell me what the patient is wanting
going to do, and then I will do the quote presentation and collect the payment. So let's go do that.
Hi, Ashley. Today, I see that we're going to be doing your Botox, your lips, your cheeks, and your smile lines.
Yes.
Perfect.
I'm really excited.
Yay! All right, I'll go tell Anisa.
Awesome. Thank you.
Okay, Anisa, she is doing everything that you recommended today. Perfect. Thank you.
You're welcome.
Okay, so I'm gonna go ahead and prep all the filler. I already got started on the Botox, so we're good for that. This is my lip tray and Botox. I recommended 2 sprays of Voluma for Miss Ashley. So what I like to do is just unpeel back the filler, make sure that I don't waste any time in the room, save the lot number for charting, and prime the needles. I also recommended 1 syringe of Restylane Define. I think this is a great filler for her type of nasolabial folds. I like to reserve this type of filler on patients with a really deep crease. It's nice and thick, so it fills beautifully. Whereas someone with a more fine crease around the smile lines, I really like Velour for that. Both of those fillers are dynamic, meaning that they're stretching and move with expression. So I really like that in terms of it looking very natural. Traditionally, Juvederm used to be injected into the nasolabial folds, and while that provided a good correction, we saw over time that when they would talk and smile, the smile lines would stretch into a flat kind of position, and it would be really bulky, making people look like a monkey. So we don't want that. We want very, very natural results here at Beauty Boost. Okay, so let's do this. Here's your beautiful tray with all the nice products.
Love it.
We're gonna start your treatment with your Botoxers, so that's like super quick and easy.
Okay.
And then while you continue to numb, I'll move on to your lips,
Okay.
and then we'll finish off with the cheeks and smile lines.
Sounds good.
This is really your post-care instructions. I'm gonna finish to disinfect you and take off some makeup. I'm just gonna mark you off and have you turn this way. Get really mad for me. All the way. Eyebrows up high. This is for spot prevention. This is not to treat your forehead lines as we discussed. It just helps it from not looking spotty. I'm gonna turn this way and relax and smile really tight with your cheeks. For your brow lift and a little bit of the crow's feet here. And you can relax. And now give me a really sad face. What's up, harder? Perfect. And you can relax. Let's get started in the forehead area. Okay? Oh yeah. So first time Botoxers, love, love, love the results. I will tell you, everyone who does Botox the first time feels very, very stiff and tight for the first month.
Okay.
You will overcome it after the 1 month mark, but it's a common report, and don't be scared, you will loosen up. Very few people experience headaches after treatment, and if that's you, just know that Tylenol can get rid of the headaches, and it's only for a week. And for these fine lines that makeup likes to settle into. Wrinkle your nose from your left. Stay right there. I know it's a little pinchy right here. Hang in there. You will love this. You can relax. I don't know about you, but when I smile, my nose tends to stretch and look wider when I smile.
Yeah.
This will help it.
And I have a naturally wide nose too. This doesn't even hurt.
Awesome. I'm so happy for you. Give me a sad face one more time. Or a frown. Actually, invert your lower lip. Right there. Go ahead and do it again. Girlfriend, you're done with your Botox. I saved the Botox lip flip for when you're done with the lip filler, so you don't feel like this is a little pinchy area. Okay. It's the only area you have left. Okay, actually, we're gonna go ahead and do the numbing shot. I'm gonna go inside the mouth, just like at the dentist. It makes your entire lip and teeth go down for about an hour. This makes it super comfortable. I don't know about you, but your first time when you got lip filler with a numbing cream, it might numb the outer layer, but you still feel like every poke. This just eliminates all discomfort.
Oh, fabulous.
So then look inside the mouth, the jaw open a little bit, and feel a little pincher. 1, 2, 3, good job. You might feel a little sting. Doing okay? Perfect. Same thing on the other side. Feel already some numbing taking place. I'm so excited for your lips. I know exactly what you need in terms of the outer lip support, especially for the upper. And you're gonna experience like literally one of my favorite lip fillers. So yeah, you're all warmed up. I'm gonna go ahead and disinfect your lips with a little alcohol. Get Let's make sure you're nice and numb. Anything sharp here? Perfect. And if you can maintain that open mouth, that'd be perfect. So for Miss Ashley, I am using the insulin syringe. I really like the placement when you use smaller needles. It just makes a more precise fill, in my opinion. And when we deposit a little bit amount of filler each time, we can prevent any lumps or bumps from forming. That allows her more symmetrical, even fill. She will be bruised and swollen for up to 2 weeks. If she's concerned about the bruising, we always recommend taking some arnica tablets. That just helps speed up the trapped blood underneath the skin that causes the bruise. It's a little bit quicker to resolve. And pineapple juice also helps because it has that bromelain extract in it, which helps clear up bruising. I do want her icing as much as possible today. That's going to help with the swelling. I will be sending her home with some steroids as well, based on the number of pokes to the lip, cheek, and smile lines. Having a steroid is going to help her healing a little bit more quick. I'm going to move on to the bottom lip. Anything short here? Perfect. So her lower lip is pretty symmetrical all throughout. I do feel like her previous filler was focused more centrally. So today I'm going to work on blending her previous filler and her present lip shape together so that way it looks more balanced with the upper lip we just did. I always recommend no pursing lip movements, including sucking out of the straws, vaping, aggressive kissing, because it can technically push the filler back behind the border while it's healing over the next 2 weeks. So we always say take it easy on these puppies because we really want it to settle really pretty. She has a really great medial cheek, really great volume, just giving her under a lot of nice support. But when it comes to the lateral cheek, when we create that contour, it gives the most beautiful lift. For those of you who are fixated on your smile lines, always know the best approach for filler is to fill your cheeks before filling smile lines so you don't look like a monkey. Okay guys, we're going to start right here. You're going to feel a little pinch, 1, 2, 3, no pressure here. I typically like to do 1.1 to 0.2 aliquots in each injection site. I usually like to hug the zygomatic bone, just to make sure I get right on bone, which allows for the best placement. Also support any ligaments that are starting to descend with age, fat pad, skin, and muscle. And halfway down on this side. Checking back from the front view just to make sure that she's getting that nice lift and projection. Pain here? Perfect. What side do you sleep on? Your left?
I usually sleep on this one.
The left side, yeah.
Yeah.
You can kind of tell because this smile line is deeper, so usually that's a giveaway. I'm going to put a little arnica on the injection sites. And while I move over to her left side, I'm going to have her use a tongue depressor on her right side, and that will help position the filler. So have you hold with your 3 fingers down and back and light pressure, please. Okay, let's go to the other side. Consider this as a liquid facelift. It's a lift that you literally can't achieve with plastic surgery because the result is so natural, so effortless, whereas when you do a facelift, it's such a dramatic pullback, and not everyone's a candidate, especially for her, she's so young. So that's why I love fillers, for a little lift and support. Crunching. It's the skin that breaks that can be really disturbing, but it's all part of it. It's working. Yes. Like, I like hearing it.
Is that weird?
Right? No, I I'm the same way. Like, I want to know that what you're doing is providing something. Let's see how this cheek is doing. Beautiful. So sweeping on this side, back, and light pressure. We're going to move on to smile lines. A lot of people develop this triangular shadow by the nostril. It's called the piriform aperture. We start to lose a little bit of bone and support here as we age. So that's why I'm filling close to the nostril for that support. And already you can see her smile line is completely diminished. I'm gonna move on to the edges of the lip. For this, we're gonna have her open her mouth just a little, perfect, with a pinch here. And I always think of this as like a bolster, meaning that if we put product in the corner, it literally lifts it like as if it's sitting on something. And close her mouth. And as we could see, her corner is lifted up so pretty. More right here. You might notice the curl really everting up, which is pretty, but it actually always ends up settling to just a great neutral position. Finger down on this side. I'm going to place my fingers inside your mouth for a little massage in here. I like to put a little pressure massage in the modiolus area of the mouth, just to make sure that we don't leave her with any kind of lumps or bumps that are uncomfortable. Pose. I'm going to do one more spot here. I always check where I'm at in terms of progress by bending the skin. If it bends, it tells me that she can get a little more filler here. So that's why I'm revisiting this area. We do want to make sure we save enough for the other side, so let's go on to the other side. So as we could see, it is much deeper on her left side. Again, she did say that she slept on that side. So I'll go straight into the piriform aperture, a little pinch here. Again, to fill that little shadow that we start to get with age. And as we could see, even just that little bit did a lot for her. Supporting the oral commissures here for support to help flip her frown upside down. Jingle for the viewers. Oh my god. Kindergarten class. Let's flip that frown upside down, okay, children? You're all done. Maybe a little massage on this side like the other. So just keep in mind, just like Botox takes 2 weeks to settle in, so does filler. While we can appreciate immediate fill today, final results look even better. So your cheeks and your smile lines look so good.
Oh my gosh.
Right?
My smile is like
Up.
Yeah.
Mm-hmm.
You're amazing.
Just like I said before, if you still see a little shadow here, don't worry. This is going to pick up even more when the filler integrates with the tissue. Mm-hmm. And when the Botox relaxes that depressor muscle, everything will go up, which is going to look even better. Okay. Cheeks got a beautiful fill. I suspect you're going to need a little more, to be honest, just so you have a little more surface area to cover. Okay. I'm really happy with how natural it looks, but let's see in 2 weeks to maybe do a little more. So pretty. Let me give you a clean mask to go home with. And then I'll also grab you a lip ice pack. I'm excited for you, babe.
I'm super excited.
It's such a pleasure treating you, and I'll see you in 2 weeks for your follow-up.
Okay, awesome. Thank you so much. I'm like so excited.
Okay, so my patient's back for her 2-week follow-up, so let's check her out and see how she healed. Hey, Ashley. How are you, girl?
Good. How are you?
Oh my god.
You look so cute. Oh my gosh.
Thank you.
So adorable.
How are you feeling?
Pretty good.
Yeah?
Yeah, pretty good.
See?
Thanks.
How's it feeling?
Good.
Yeah?
Yeah, really good.
Cheeks look nice and lifted. Oh, this looks so smooth and tight.
It is very, yeah. It like went through like different stages. It was like very interesting like to see like the different stages. But I'm like, I don't even think he really injected anything much up here and it like just...
There's some diffusion from the frown lines. Like when we do Botox here, there is a little bit of a correction on the forehead lines. That's why I'm like, just skip it.
Yeah.
Because for you didn't have severe lines.
Right.
So let's take a look. It really mattered for me. So yeah, no more frown lines. You're so good. You're like, and then eyebrows up high. Perfect. See, it like totally corrected that, which I love. So it's a cute little trick to save money. It's not a really tight. Yeah. Look at that. Your brows bounced up, girl. You got like one of the best brow lifts I've seen in a while.
Awesome.
So sprinkle your nose with a bunny. Perfect. So that corrected really nicely. And then you get kissy face. Oh, look at lips. Okay, let me that's all the way. Let me feel around. A little massage down here. I love the shape you got. You could do a good cute little recliner. Side a little bit of your teeth. So pretty. You do for me, that's all the way. Cheeks are holding up really nice I really like how it just like gave you that contour.
Mm-hmm.
You remember like you were a little bit flat back here?
Yeah.
But now you have that beautiful like lip, like high cheekbone look.
Mm-hmm.
Smile lines. And this is such a good correction here, so you don't have these shadows right now. I think in the future, we need to do a little more on that left side.
Okay.
Remember, where some sides need a little bit more, so I think we should just maybe pop in a little bit. I can do that for you today, or we can hold off on it for a couple months, but I think we just need a little bit more there.
You can do a try.
You look so good.
Thank you. I love it. I couldn't believe like how smooth my forehead was.
Right?
I'm like, oh my gosh.
This takes you back to like youthful you.
I know.
That's so refreshing. You know what? Let me have Angelica, this doesn't come in, and take some photos.
Okay.
And put some numbing on that guy.
Okay.
And I'll let you go.
Okay.
So I just saw her and she's so happy with her results. Her Botox settled in beautifully and evenly. Her cheeks are nice and lifted. Her lips are nice and full. Her smile lines are beautiful, but she needs a little bit more of a correction on the right side. Now this is always common at follow-ups where you need a little more filler to do a little more correction. If the patient's happy, I'm happy. So the purpose of these follow-ups is to make sure you're getting the results that you wanted, and that way we don't need to do any additional touch-ups. All right, you ready for that?
I'm ready.
So that's you getting that.
Oh my
So
gosh.
you're really pulling centrally the frown and nose, and then you smiling really hard. No more close to you.
Oh wow.
Crease. And then check out your smile lines, much softer, but still we gotta touch up that one side.
Uh-huh.
And lips looking nice and juicy, and then the cheeks is my favorite.
Oh, I can totally. Oh my god, I love it. That's weird because you get like used to it and like being able to see like before.
Mm-hmm.
I love it. You're a magician.
Thank you. You're so sweet. Okay, girl, let's get you up to do the little additional filler you need on the left side. Forget, is that your sleeping side?
I sleep on both sides, but I'd say probably more so in this.
Okay.
I'm definitely a side sleeper though.
Yeah, I'm gonna change that. I'm telling
I
you,
know it's so bad.
your whole side of your face gets affected by putting all that pressure 68 hours every night.
Yeah.
If you can invest in a good beauty pillow, do it. We have one under our Amazon favorites if you ever want to.
Oh, really?
Like I prefer.
Okay.
Yeah, it like cradles your head so you just don't roll around.
Oh, that's okay. Perfect.
No, good girl, because it totally influences the healing. If you put pressure there, like the filler can potentially move. Have you come forward, please? You just need a little more, so hang out here, I'll be right back. Beautiful, that's better. Okay, so we just did a half syringe additional to her left nasolabial fold, also known as the smile line. She just needed a little more to pop out that shadow. I'm really happy with the correction here today. She has a little bit of bruising settling in, but it's gonna look even better at the 2-week mark. So I'm really happy she came by so I could take a look and do further correction when needed. Okay, Beauty Boosters, I hope you enjoyed that experience from the minute you walked in to the minute you get treated and the 2-week follow-up. So if you guys like these videos, please let us know. Like, comment, subscribe, and let us know what videos you want to see in the future.